Saiti, 1 minute wait. Some doctors are joining. Only 1 minute wait. Some are having a problem in joining. Just a second. Huh? I'm not. Huh. Why you're not able to join? Yeah, program is going on. Yeah, Saiti. Yes, Saiti. Yes, start. Nishant, we can start.
Okay. Good evening, delegates and participants. Thank you for joining Shield Connect. Today we are back with our series Icons in Conversation with Dr. Ritu. And today we have Dr. Professor Rubina Sohail. And the topic of today's session is women's health and women in conflict. Let me introduce our sponsor of this series, Dr. Ritu Santwani ma'am. Ma'am has done MBBS, MD, FICOG, FIAOG, AMRCOG, obstetrician and gynecologist in IVF, founder and CEO of 360 Degrees Healthcare Studio, and ma'am is also specialist in Inamdar Multi-Speciality Hospital, Pune, infertility test tube baby specialist. Ma'am has done NUHS Singapore, co-founder of MAAM and board member of SWWC. And now let me introduce Professor Dr. Rubina Sohail. Ma'am has done FCPS, FRCOG and Professor of Obstetric and Gynecology. Ma'am is consultant at Hamid Latifa Hospital from Lahore, and ma'am is champion of sexual and reproductive health and rights and pioneer of kangaroo mother care in Pakistan. Ma'am is chair of FIGO Committee on Women Facing Crisis. Ma'am is also deputy chair of the Scientific Program Committee, FIGO Conference Paris 2023, and ma'am is past president of SAFOG. So, ma'am, we welcome you on our platform for today's webinar, and I hand over the session to Dr. Ritu Santwani, ma'am. Thank you, ma'am.
Thank you.
Thank you. Thank you, Nishant. Friends, I hope all of you agree with me. Where there is a woman, there is a magic. So how many of you agree with me on this? So please put your answers in the chat box. So today I can say we are honored to have with us the Madam Professor Rubina Sohail Madam. मेरा और मैडम का कुछ ऐसा रिश्ता है, मैं मैडम को जब जब अप्रोच करती हूँ, आई नो मैडम शेड्यूल इज वेरी वेरी हेक्टिक, पर मैं जब भी मैडम को अप्रोच करती हूँ, मैडम somehow takes out the time for us. So ma'am, I can say I am honored to have you with us. So we have done earlier also so many shows along with the madam. Madam has come in my academic marathon also, which was very very popular across the geography, and madam's lecture was very very well appreciated by all. Madam, you see, I can say it's your charisma. We are able to see here the Dr. Samuel Ajbur. He has joined all the way from the Africa. Ma'am, you can see in this list only some of my friends have joined from India also, and Dr. Urus has also joined. So many doctors have joined from different countries. So today the madam is going to share with us a very very important topic regarding the women's health and women in conflict. I think this is a very burning topic. So now doctors keep on joining. So madam is a wonderful orator. I know madam is again traveling tomorrow, so still the madam has taken out the time. So now without wasting time, first all of us can listen to the madam. Meanwhile, if any queries, friends, I request to all of you, please put your questions in the chat box, so later on we can take. Madam, a very very warm welcome. Ma'am, हमारे इंडिया में जैसे बोलते हैं ना, तहे दिल से आपका स्वागत है.
Ritu, thank you very much. I feel so much at ease when I am with you, and that is also one of the reasons I can never say no to you. I really enjoy talking to you, and I really think the job that you're doing, it needs time, patience, love, compassion to do what you do, because I'm sure you're a very, very busy person, and with all your academic activities, with all the clinical activities, you find time to do this, especially for the young doctors, I would say all over the world. And I know that you've got a huge following, people want to listen to you, and people value what you bring to the table. So thank you very much for thinking that I am a person who should be at the table. Having said that, I would just start by sharing my presentation. And I think that I want to say something which is extremely important at this point in time. And that is the fact that why do we want to talk about women's health in conflict zones? You know, while we are trying to achieve the sustainable development goals, and we are working in a big way and looking towards 2030, trying to see that whether we will be able to achieve the sustainable development goals in terms of women's health, neonatal health, in terms of hunger, poverty, so many parameters for sustainable development goals. But we fail to realize that any kind of conflict taking place anywhere in the world, it affects the women's health in a negative fashion. And this negative effect on women's health has got repercussions not only for these women and their families, but the repercussion goes much beyond those particular women. So these repercussions go beyond to the sustainable development goals, and they actually drag down the progress that have been made in terms of achieving the sustainable development goals substantially. So that is why this topic is very pertinent and very important. The second reason, and I would like to spend some time talking about that, is that women's health in conflict zones is important because conflict is not only in terms of war. Conflict zones are created by crisis. And what are the kind of crises that can happen? So, floods happening in Pakistan is a crisis. Economic breakdown in Sri Lanka is a crisis. The migrant Rohingya crisis is a crisis for women. So all these people, when we look at them, people migrating from Afghanistan, living in refugee camps in Pakistan is a crisis. And women in war obviously are in a crisis situation. So when we look at all these parameters and we look at these women, we need to realize that what is the role of healthcare provider vis-a-vis these women who are living in conflict zones. So my two reasons for thinking that this topic is extremely important are these two, and that is why the topic for today. So the outline of my presentation would be that why are we talking about women health in conflict zones, relationship of women's health and the sustainable development goals, conflict and how does it affect the women's health, and what are the solutions? Can anything be done to manage this situation? So first, I have just outlined a little bit of it, but just talking about the relevance of the topic. The important thing to realize is that women and girls are representing almost half of the world's population. 2 billion of the total world's population, or one-fourth of the world's population, is living in zones which are affected by conflict. So if I can say safely that we are talking about 1 billion women when we are talking about the health of women who are living in conflict zones. And in addition to these women, there are obviously adolescents and children who are going to be affected by conflict. That is the first thing. The second thing is that women who are living in these conflict zones or in post-conflict settings are extremely vulnerable women because these women will have poor reproductive health. They will have, they will be likely to experience sexual violence. They will likely to have unwanted pregnancy, and there can be adverse maternal health outcomes for them. So that is why we need to focus on these women, as I said, that they're going to drag the sustainable development goals down. Now, when we are talking about women's health anywhere, especially so in conflict zones, we have to remember that gender equality is to be at the heart of all the work that we do in trying to achieve equity for the women and trying to achieve the women's health and to make sure that the women at the forefront. So when COVID happened, what happened to the women in conflict and what happened to the other women? All the finances that were there for the health of women, many of those finances in many of the countries were transferred to the COVID funds. So women basically were left out of the relief work. And women have to be obviously then kept at the forefront of any effort that is going to be there to deal with the health of women. And their issues are actually very, very relevant to the world. Today, I was given a talk in one of the hospitals on mental health of teenagers, and one of the male doctors sitting over there commented that males are also very important. So, no doubt about that, that the males are important. But it is important that these issues of women are extremely important because not only are they going to affect the women's health, but they are going to affect the academics, they are going to affect medicine, they are going to affect at an industrial level, at a social level. So that is why this discussion of women's health in conflict zones is not a topic which should be only relegated to the sociologists, but it is a topic on which the OBGYN community need to be very aware, and they have to ensure that consequences of all of this is make sure that the OBGYN community is well aware of the consequences of what is going to happen to the women's health in the conflict zones. Just sharing one of the pictures of our committees, and these are the committee members of who are sitting at FICOG working for women facing crisis. So FICOG has got 4 pillars on which all the work is done, and those 4 pillars are basically in terms of education, research, advocacy, and capacity building. So the FICOG committee, which wants to create a global voice for women, is basically working on the basis of these 4 pillars. Now, when you look at the victims of war and the refugees and the migrants, you need to realize that in the current day war, so many a times when we used to talk about war in the past, we would think about the army, about the soldiers being injured. But nowadays, the victims of war are mostly women and children. And women and children, not only because they are affected directly or indirectly, they become the casualties of war, but also that the fact that they are being increasingly used in a deliberate fashion as weapons of war. So the warfare has changed, and in order to crush the enemy, it is very important that they crush the women and the children of the enemy. 90% of the victims of war nowadays are basically civilians, and majority of them are women and children, and that is a very important information that needs to be known. Now, the health of more than 630 million of the women and children, which means around 8% of the women and girls around the world, is being adversely affected by armed conflict. 1 in 10 women, 1 in 6 children worldwide were either forcibly displaced by conflict or they are living very close to these conflict zones. And 1/3 of these people affected are living in Pakistan, India, and Nigeria, which just creates a scare that the area of South Asia that we are living, 1/3 of the population over here are affected by some kinds of conflict. Now, when women are living in conflict zones, violence against women, especially intimate partner violence and other forms of sexual violence, they are also on the rise. And they are also on the rise because over there is lack of gender equality, there is inequity for women. Women are vulnerable and they are more prone. And as I said, they're being used as weapons of war. So women suffer because of the sexual abuse, physically, mentally, sexually, and their reproductive health is affected, and they have got a greater probability of developing infections, especially the HIV. I'll just share with you a story of a survivor of gender-based violence in Iraq. And it really touches me to the core of my heart. And the story is that of a girl whose name was Katan. And she says that we were alone and in the dark, with little food, and we were captives to militants. The militants would boast and say that they would divide the captive girls among themselves as they wished. Katan says she was horrified and cannot describe the fear that she felt that day. When the girls objected and told them that they were too young to wed, they were beaten and they were tortured. She says, we had no choice but to give in to the perpetrators. That is the story of so many young girls who are suffering because of the war. So atrocities of war are not only trauma, but also subjugating the enemy's daughters and women and children to rape, torture, related debasement by also using methods like prostitution, domestic violence, forced impregnation, and maternity. So there are so many phases of atrocities of war. And if you look at countries, Yugoslavia, Rwanda, Darfur, Congo, Syria, Bosnia, Iraq, Ukraine, and the list goes on and on, then the kind of atrocities that the war is producing. Now, when we think of sexual violence in conflict zones, one always thinks that because we are living in the current day and time, one likes to think that they are probably sexual violence is a recent phenomenon. But I would just like to bring to surface that sexual violence in conflict is not a recent phenomenon. And books have been written about it. And I found this book of sexual violence in conflict zones by Dr. Elizabeth. Handyman. And this book is actually a very, very eloquent book. And there are other books which have been written on the topic of violence in the conflict zones. So conflict, war, and situations of political instability, they are basically exacerbating the pre-existing inequalities with women, girls, and marginalized groups who are already suffering. And when they come into a situation of conflict, the suffering increases. There is lack of access to sanitation, lack of access to healthcare, and there is increased risk of gender-based violence, greater probability of early marriage, human trafficking, and the aftermath. So the list goes on and on. And if you look at the perspective of women's health being affected in this fashion when they are in a conflict situation, and you look at the sustainable development goals, which are 17 in number, and you look at the goals of hunger, poverty, equality, health, etc., you realize that in order to make 2030 agenda a reality, we have to convert this theoretical ownership of SDGs into strong commitments. And that strong commitment has to rotate around protection and promotion of women's health and rights. And only then we are going to be able to achieve the sustainable development goals. So out of all the sustainable development goals, I have identified 4 development goals which I think need to be integrated and which are the areas in which we need to work, especially if we want to achieve the other sustainable development goals as well. And they are basically, as I said, poverty, hunger, health, education, equality, climate change, justice, and partnership. If we collaborate, if we integrate them, then the sustainable development goals will become a reality. And without them, we are nowhere. Now, look at the world map, and this actually shows that in the world, there are different kinds of conflicts and different kinds of situations that are happening. So, political instability, sectarian violence, terrorism, civil war, territorial disputes, and other things, they are all constituting for women in crisis. And it is not only that the women who are in war are in crisis. And as I said before, that for example, the floods in Pakistan have put the women in a crisis situation, making the vulnerable women more vulnerable. If you look at the conflict affected countries, and red and orange are the main affected zones, so and the yellow ones as well. So if you look at the world map, most of the world map is colored red, orange, or yellow. And this actually is showing the world, and this is an old map, it is of 2016, but this is showing the world that how much of the world is affected by the conflict situation. Now, the question arises, what happens to the women and what happens to them when there is conflict? So there are direct and indirect effects. So direct effects, we are already thinking about them. They are in terms of physical and mental trauma due to the direct exposure to bombs and bullets. So basically, we are thinking about a situation when the woman is in the center of the conflict. But there are so many indirect effects, and those effects are the ones which also magnify that physical and mental trauma. And these are mortality and morbidity due to the destruction. So they lose their homes, they lose their shelter, food and water supplies, electricity, transportation system, health system, everything actually is affected indirectly by the direct consequence of a conflict. And if you look at the women, and if you look at the gender-based violence, because whatever we do, that is going to make the weaker women more weak. And these weaker women are more subjugated to various forms of violence. And their physical, mental, sexual, and reproductive health of the women and their children and their well-being is affected significantly. Now, if you look at the short-term and long-term effect of these issues, so the short-term effects are in terms of physical injuries, unintended pregnancies, sexually transmitted infections, induced abortion, depression, but they have got long-term effects as well. And depression can be lifelong, increasing the tendency of suicide is huge. And I was reading up a couple of days ago that the incidence of suicide all over the world, not only in conflict zones, but all over the world, it is on the rise. So we have to be really careful with these women that are there, which are affected because of the conflicts that are happening. And in a conflict, there is basically breakdown of political, economic, and social structures. So when you look at the general effects on the women and the children, as I said before, there is a problem with the shelter. The makeshift shelters are overcrowded with issues of sanitation. There is no access to education. money is not there, they have got mobility issues, no job, insecurity of food and malnutrition and infectious disease. But when you look at the health issues, so sexual violence, human trafficking, post-traumatic stress disorder, breakdown of immunization service, no sexual and reproductive health services, unwanted pregnancy, lack of abortion services, and early marriage. These are actually some of the issues related to the health of the women and the girls. Now, when we keep on talking about them, one thinks, why is there war? So, if you look at the solutions, probably the best solution is not to have wars, not to have conflicts, not to have women in crisis. And if you look at this slide, this actually is showing only some of the UN security resolutions for women, peace, and security. And they are not all of them. I just tried to handpick some resolutions which I thought I could fit in to show you that so many resolutions have been passed by the UN Security Council. But the problem with the resolution is failure of implementation. That there is no implementation of the UN security resolutions. And this is a cause for serious concern. And we need to think about what are the reasons that the UN security resolutions are not being implemented. So when you look at the resolutions and when you look at the solutions, the first and the foremost things that come to my mind is we should say no to war. There should not be conflict. But conflict and crisis are going to happen. So we have to make sure that we have to implement the UN resolutions. We make sure that we help and support to develop a partner strategy, and we have to have resilient strategies in place. These are the basic overarching issues that we need to take care of. In addition to that, obviously there is need to build shelters to protect the women and the children, to make sure to create education facilities, have some social corporate mechanisms to generate finances for this displaced population, to think about food and nutrition to prevent malnutrition. In addition to this, we have to ensure high quality maternal health services. So, to women in crisis, providing maternal health services of high quality is a real challenge. And also trying to eliminate the sexual violence in conflict zones. It needs a tailor specific, dignified humanitarian response strategy which works across sectors. So these two very important issues in relation to health, the maternal health service, and to make sure that the sexual violence in conflict zones is eliminated is important. So we have to follow a right-based approach, making sure that the sexual and reproductive health services are in place, postpartum care is being provided, effective contraception, prevention of unwanted pregnancy, safe abortion services availability, treatment of traumatic stress disorder, and immunization facilities are in place as points of care for women and children when and as they need help. Now, this will only happen when we put women and children and the girls, we prioritize them and put them in the center of the response of whatever we are trying to do. When we integrate the healthcare and make sure that we talk about the sexual education with the youngsters, we build a community around access to sexual and reproductive health care. And remember that different conflict zones have got different reasons, and the response that we are going to create for different conflict zones will have to be modified according to the requirement of that particular area. And I think that is a very, very important point to remember. I'm coming to the end of my presentation, but when I'm going to close my presentation, I just want to say that when there is a war or when there is a conflict, there are no winners. In war situations and in conflict situations, people think that there's going to be a winner. There's no winner amongst the countless casualties in armed conflict. But and especially so the women and children, because they are victimized by militants who have weaponized sexual violence as a tactic of terrorism, torture, and war. So women and girls are being used, and we have many, many treaties and recommendations which are there, but there is gross failure of implementation of these treaties on part not only of the developmental partners, but the governments and the organizations. Somehow, all efforts to bring those treaties into perspective has failed. So we have to make sure that the women and girls are protected, they are prioritized in times of conflict, their sexual and reproductive health and rights have to be ensured. This is the only way forward for us, and that is what we have to follow. This brings me to the end of my presentation, and I just want to share my last couple of slides with you. And this, as being chair of the committee, I think I would like to share some thought with you that we need political commitment, we need greater funding, we need stronger leadership to implement the UN resolutions and develop policies to ensure that the sexual and reproductive health and rights for women and girls in conflict zones are taken care of. And with that, I would like to finish my presentation, and I would like to invite all of you to the FIGO Congress in Paris in October 2023 to come and present your work. And very soon, the call for abstracts is going to open. And I would like most of you to put in an abstract over there, and maybe we find an opportunity to meet Ritu and all of her friends, which I see and meet online in Paris in 2023. Thank you very much.
Thank you, madam. Thank you so much. A very nice presentation. You have covered each and every aspect. So, Dr. Nishant, please help me to check on the other social media, but that if we have received some questions. So, meanwhile, madam, as you know, this show's name, earlier you had come on my show on the academic marathon. So now this show's name is the Icons and Conversation with Dr. Ritu. So now we have covered the one portion, the academic. Now there is another round of this session. So here I'm going to ask you some questions. It is a rapid fire round. You have to answer in one word without thinking much. So whatever comes in your mind, you can answer, ma'am. So, ma'am, you are role model for so many of us. We all see कि हाँ हमें कैसा बनना है. If we go abroad, so we always think, yes, whatever the madam is doing, if we can do something like that. So I want to know, ma'am, who is your role model?
My role model is Professor Ritu. He's a very senior gynecologist from Pakistan. So I have always followed him, and but he's a very big name and very difficult to catch up with. But he's my role model.
Okay.
I can name another person. Actually, my mother was a doctor and a gynecologist. So when I would look at her, at that point in time, I thought she works very hard. And maybe we should not become a gynecologist because it takes away the time from the family, and you know how children think of their mothers. But when I became a doctor and went into the house job for obstetrics and gynecology, I realized that it is so very important to give something to the patients. And our specialty gives a lot of love, compassion, and the gift of a baby to the couple. So I think that this is our way.
Okay. Ma'am, related to this only my other question. Ma'am, what motivated you to become a doctor? Is because your mom is doctor, that's why you opted this line? Or there's a pressure from the family कि आपको doctor ही बनना है? Huh?
Actually, there was no pressure. It was motivation because my mother was already there. And we were so inspired by her. We were very impressed. We thought what she was doing was very relevant. So that is why I became a doctor. But gynae was not my first choice. I wanted to become a surgeon first. And everybody said girls don't become surgeons. So when I started my house job in obstetrics and gynecology, I realized that gynecologists are also surgeons. And maybe there is a much bigger agenda related to women's health as compared to the general surgeons. So that's why I chose gynecology.
Okay, great. Ma'am, you are a tea lover or coffee person? Huh?
Actually, both.
Both. नहीं मैम एक आंसर देना है, one word.
Coffee is my answer.
Okay. And ma'am, which is your favorite color?
Red.
Okay. That's great. Ma'am, can you name one of the place where you have visited and you liked it very most? Huh?
Oh, that's a difficult question. Actually, recently we went to, I'll just share where we recently went. We went to Colombo for the SAPOC conference. And this place called Veligama. It is like 2.5 hours drive from Colombo. It was actually very beautiful, very scenic, and right by the Bay of Bengal. So, and it had the southmost point of Sri Lanka. So that was really, really beautiful. Beautiful coconut trees along the beach. It's a very romantic place to go.
Okay, great. Ma'am, meanwhile, so we have not received any questions as Dr. Nishant has dropped me a message. Ma'am, now my another question. Ma'am, see, this is very commonly the question asked to all the stalwarts. The same question I'm asking to you, ma'am. If you get some superpower for a day, what you will be doing?
I will put women in the chair to lead the nation. And I think
Okay.
all
Awesome.
the issues of women will go away if the woman is leading the nation. And I'm a great believer in the power of women. So if I get an opportunity, I will put a woman over there.
Great,
It's
great,
very
great.
simple.
Great, ma'am. Thank you so much. Ma'am, so before we wind off, I want your some message for the upcoming doctors.
Thank you very much for this. I think I'll give a message which is related to our talk for today.
Yeah.
Uh, when I start speaking about women's health in conflict zones, I find that many times during the first talk, especially, people do not understand that what is the relevance of this issue with women's health actually. And people who are going to attend the FIGO conference and all the international organizations are not now started talking about women's health in conflict. And I think that it is an extremely important area, as I said, that women are being subjugated to various forms of violence in conflicts of various, either it is in conflict or they're facing natural disasters and other situations. So I think as a healthcare provider, we have to be very sensitive to the needs of the women, develop an empathetic approach, and make sure that whatever the situation of the woman, we are ready and we have our capacity in place to deal with the situation. So my message to the youngsters is build your capacity, improve your knowledge and know-how of the women in conflict, and be there to help and support them when they need it.
Thank you so much, ma'am. So thank you once again, ma'am, from the bottom of my heart. So because of sparing your valuable time with us and sharing this immense knowledge with all of us. So friends, with this, we will wind up for the session for today. Thank you, Shield Connect, for providing the platform. Thank you, Dr. Nishan. Thank you, Sahiti. Friends, only one announcement, Dr. Nishan. Friends, do not forget to please tune in on next Thursday at 8:30 p.m. Indian Standard Time. Next Thursday, we are having Dr. Fazia Hussain from the Bangladesh with us to discuss with some important topic. Yes, over to you, Nishan. Yeah.
We received one feedback from Dr. Nadia Noreen.
Okay.
Ma'am want to confess thanks to respected ma'am Rubina and the host for such a nice talk.
Thank you very
My
much.
pleasure.
Thank you.
Yeah.
Thank
Rubina
you.
ma'am. So ma'am, we can wind up for today's session.
Yes. I want to meet Rubina ma'am sometime soon in
Really,
person.
I also want to meet you, and hopefully we will meet very soon. Thank
Okay,
you very
sure.
much. Thank you very much, and a good day to everyone. Thank you.
Yeah.